Welcome to the Deep Dive. We're here again to synthesize a whole stack of research and really deliver the knowledge you need fast. Today, we're diving into something that honestly kind of challenges what most of us think about our own faces. We accept that we can change our bodies with exercise, gain or lose weight. But our facial structure, we usually think that's just down to genetic luck, right? Fixed.
Yeah, that's the common idea. But, well, it turns out that belief is pretty flawed. The sources we've looked at show really clearly that you can actually change the physical structure, the symmetry of your face for the better. And not with surgery or anything drastic. It's about correcting some consistent, often subconscious daily habits.
Okay, hold on. We're talking about adult bones here. The idea that your skeleton, your face, can be reshaped by just how you sleep or chew, that sounds, well, incredible. Is the science really solid on that? That our bones are still that flexible?
It really is. Now, we're not talking huge overnight changes. Think subtle, continuous pressure working on the junctions between the bones. Your face has 14 separate bones, and the key thing is they don't fully fuse together until you're quite old. So yeah,
Yeah.
there's a small but significant amount of potential movement there throughout most of your adult life. And if you apply consistent pressure, internally or externally over time, those small movements add up.
Right, okay. Accumulation. And why does this facial geometry matter so much? I get wanting to look good, but why are we, biologically programmed to notice symmetry?
That's pure evolution, goes way back. Historically, a symmetrical face was basically a billboard for good health. If someone had a symmetrical face, it suggested they hadn't had major problems during development. No serious illnesses, good nutrition, no bad accidents. Biologically, they looked like a low-risk, high-quality potential mate.
Makes sense.
And what's really fascinating is that aesthetic trends, fashions, they change all the time. But the stuff linked to health, that stays constant. Facial symmetry is a big one. Also, those body ratios, waist hip in women, waist shoulder in men, we're just wired to find health attractive.
Okay, so if we want to tap into that, improve that signal, and maybe our health too, where does asymmetry even come from if it's not just our genes?
Well, it's usually a mix of environmental things. The research points to stuff like smoking, dental problems, definitely, poor posture, just general body posture, and even things like uneven eyesight, like favoring one eye over the other. These all subtly nudge facial development off course. The tricky part always is separating what's habit and environment versus what's purely genetic.
Right, the classic nature versus nurture problem. So how did researchers untangle that? Let's get into the data.
Okay, so there's a really key study from 2014. They looked at 147 pairs of identical twins.
Ah, twins, the perfect natural experiment. Same genes, potentially different habits.
Exactly. By comparing twins, they could isolate the environmental factors, the habits that led to visible differences, visible asymmetry, between two genetically identical people.
So what did they find? What specific habits actually made a difference? They found two really actionable things, both related to that idea of passive, consistent pressure. First one, sleep position.
Twins who consistently slept face down prone showed more asymmetry, specifically around the nose and the corners of the mouth, compared to twins who slept on their back, supine, or on their side.
Wow. Just the pressure of the pillow night after night.
Yeah, 8 hours or so a night. That gentle but constant force, it actually measurably deforms things over time.
Okay, that's passive pressure. What about more active things? You mentioned dental work and smoking earlier.
Right, that was the second big finding from the twin study. Twins who'd had teeth extracted or who were smokers tended to have a more noticeable tilt in their jawline. Technically, it's called the occlusal plane cant. Basically, the line where your top and bottom teeth meet wasn't level, one side was lower. That's a really clear link between an adult habit or intervention and a structural change in the face.
Okay, so the first big takeaway seems pretty straightforward then. If you want to minimize that kind of asymmetry, sleeping on your back or side is best. Avoid smoking and get dental issues sorted out quickly.
Precisely. Those are sort of the baseline defenses against external deforming forces. But now let's shift gears a bit. Let's talk about the engine of change within the face. What actually moves and shapes those facial bones day to day? It's the muscles.
Okay, muscles. How does muscle tension, especially around the jaw and mouth, physically change bone structure?
It's the constant tension, the pulling and bracing from the muscles in your face, mouth, and neck. They're constantly sculpting. To really grasp the impact, it helps to look back evolutionarily. Contrast our ancient Paleolithic diet with what most people eat today.
Right, our ancestors ate tough stuff, right?
Mm.
Roots, chewy meat, fibrous plants.
Sure.
Required a lot of chewing,
A lot of chewing. Constant hard work for the jaw muscles.
which is the total opposite of our modern diet. Lots of soft, processed foods that barely need chewing at all.
And that's the key structural difference. That intense chewing in our ancestors led to much stronger jaw muscle development. And importantly, that muscle activity stimulated better jawbone growth, leading to a wider dental arch. That wider arch is crucial. It means more space for your teeth. So way fewer problems with alignment, crooked teeth, impacted wisdom teeth, all that stuff that's so common now.
So the consequence of our soft diet isn't just like metabolic, it's actually physically underdeveloping our jaws because they're not getting the workout they evolved for.
Exactly. Less muscle work means the bones don't get the signal to grow outwards and become robust. You eat soft food your whole life. Your jaw just doesn't reach its full genetic potential for size. And that changes your bite, your alignment, the symmetry of your whole lower face. It's a clear non-genetic factor shaping your structure.
Okay, so if we want to counteract that, start mastication training.
Yeah.
What does that actually mean? Should we just be chewing gum nonstop?
Well, gum might help a little, but you need real resistance. Chewing actual fiber-rich food. Think raw carrots, maybe tougher cuts of meat, nuts, seeds, even some hard, crusty breads. Things that make your jaw muscles, the masseters, really work. There's an important caveat here, though. Anyone thinking about seriously increasing their chewing needs to be mindful of their TMJ, the temporomandibular joint. That's the hinge connecting your jaw to your skull.
Right.
If you already have TMJ pain or issues, you need to be careful. Maybe consult a specialist before you start, really intensely training those muscles.
Okay, good point. So we've covered external forces like sleep and the muscles working from the outside, the chewing muscles. But you mentioned an internal force, too.
Yes, and this is arguably the most central piece of the puzzle. It's the tongue.
A tongue, really?
Absolutely. Your tongue is an incredibly strong muscle, or group of muscles, really, and it plays the main guiding role in how your palate, the roof of your mouth, and your upper jaw, the maxilla, develops. It shapes things from the inside.
Huh. So what's the correct position then? Where should our tongues be resting right now as we're listening?
Okay, the ideal posture is having the entire tongue, especially the back third, resting gently but firmly against the palate, the roof of your mouth. The very tip should be lightly touching that bumpy ridge just behind your front teeth, the alveolar ridge, but not pushing against the teeth themselves.
The whole tongue flat against the roof.
Yes. That gentle, continuous upward pressure guides the upper jaw bones to grow correctly forwards and outwards, laterally.
And what happens if we don't do that? If our tongue just sort of hangs out of the bottom of the mouth?
Yeah. Well, when the tongue drops, and this often happens because of mouth breathing, maybe due to allergies or a blocked nose, you lose that essential internal support. That scaffolding is gone. So instead of the face growing forward and outward, which is the ideal anterior growth pattern, it tends to grow downwards, inferiorly.
Downward growth.
Yeah, leading to a longer, flatter mid-face appearance, and critically, much less space in the upper arch for your teeth.
Okay, that paints a clear picture. But is the tongue really strong enough to move bone? It feels soft.
This statistic really brings it home. Research shows it only takes about 1.7 grams of continuous force to move a front tooth, an incisor.
Okay, tiny force.
Tiny, but your tongue, it can exert up to 500 grams of pressure.
500. Wow.
Yeah, it's immense. So that consistent, subtle pressure from correct tongue posture applied over years and decades, it's more than enough to guide and modify your facial structure.
Okay, 500 grams. It's
Right.
huge. So how do we fix this if we spend years with the wrong posture? How do we harness that power for good?
Well, there are techniques. You might have heard of mewing, which was popularized by Dr. Mew. It's essentially the conscious practice of maintaining that correct tongue posture, applying that gentle, continuous upward and forward pressure against the whole palate. The key is getting the back third of the tongue up there, creating almost like a gentle suction or seal, not just resting the tip.
So it's active, conscious effort initially.
Initially, yes. And related to that is correcting how you swallow deglutition. A lot of people swallow incorrectly. They push their tongue forward against their teeth when they swallow.
How can you tell if you do that?
Try swallowing right now. Do you feel your tongue pushing your front teeth? If so, that's incorrect. That forward push actively works against keeping your teeth aligned. The correct way is to swallow by pressing the tongue wave-like against the palate, using it to propel food or liquid back without pushing the teeth forward at all.
Okay, so the homework here is basically constant awareness. Set reminders. Consciously check your tongue position whenever you're not talking or eating. Build the habit.
Exactly. Radical consistency is key. But all that effort can be undermined if we don't tackle the reason the tongue often drops in the first place.
Which you said is often mouth breathing.
Right. The breathing problem. If your nasal passages are blocked for any reason, chronic sinusitis, deviated septum, allergies, you're forced to breathe through your mouth. And when you mouth breathe, your tongue has to drop to let air in. So you lose that upward posture, the forward growth stimulus gets restricted, and you pretty much guarantee that smaller, less developed dental arch.
Okay, so addressing breathing is fundamental. If someone thinks they might be a mouth breather, especially at night, what can they do? How do you retrain that?
First step is assessment. You could ask a partner to observe you sleeping, or some people use a small piece of hyperallergenic tape vertically across the lips gently, just to remind the lips to stay sealed. If you wake up with a dry mouth or the tape is off, that's a pretty good sign.
And for actually retraining.
The sources often point towards methods like the Buteyko breathing technique. The focus there is training yourself to breathe slowly, deeply, silently, and exclusively through your nose, using your diaphragm, your abdomen, not your chest.
Slow nasal abdominal breathing. How does that actually help clear airways or reduce allergies, though?
It's interesting. Buteyko works partly by increasing your tolerance to CO2, carbon dioxide. By consciously breathing less volume, you slightly increase CO2 levels in your blood. This sounds counterintuitive, but it actually triggers physiological responses that help open airways and improve oxygen delivery. It can reduce hyperventilation and, for many people, seems to lessen allergy symptoms over time, making nasal breathing easier.
Fascinating. So retraining breathing helps posture, which helps facial development. It's all connected.
Very connected, and there's even a link to gut health mentioned in the sources.
Gut health, how does that fit in?
Well, poor gut flora, an imbalance in your gut bacteria, can exacerbate inflammation throughout the body, including allergic responses and autoimmune issues. Improving your gut health, maybe using prebiotics like soluble fiber, addressing food intolerances like lactose can actually calm down those systemic allergic reactions.
Which, in turn, might make nasal breathing easier.
Exactly. Less inflammation, clearer airways, easier to keep your mouth closed and your tongue up. Okay, one more connection. Posture. You mentioned general posture earlier, but specifically neck posture. Absolutely critical. That forward head posture, head jutting forward, chin tilted up. It's so common now with screens. This throws everything off. It makes your head feel much heavier to your neck muscles, strains your cervical spine, and disrupts the whole respiratory and facial harmony. It's really hard to maintain correct tongue posture if your head isn't balanced properly on your spine.
So it's not just about aesthetics, looking taller or whatever. It's mechanically important for your face and breathing.
Totally. Correcting it involves specific exercises for cervical alignment, stretching those tight muscles at the back of the neck. You need that proper structural support for everything else to align optimally.
Okay, this has been a lot. We've gone from twin studies to chewing, tongue posture, breathing methods, even gut health and neck alignment. Let's synthesize this. If someone listening wants to make these non-genetic improvements to their facial structure and symmetry, what's the big picture? The combined strategy.
It really is a multi-pronged approach for the best results. You need to work those jaw muscles, the mastication muscles, to encourage lateral growth, making the face wider, more robust. Simultaneously, you use correct tongue posture and proper swallowing mechanics to guide the upper jaw, the maxilla, to develop anteriorly, that's forward and slightly upward. And underpinning all that, you need efficient, consistent nasal breathing and good balanced head and neck posture. It all works together.
That's the how. But let's quickly recap the why. Beyond just the potential aesthetic changes, what are the key health and functional benefits of getting these habits right? You mentioned 6 key ones.
Right.
So first, potentially improved mitochondrial function leading to more energy that strongly links to better breathing efficiency. Second, better mood, less anxiety. Often reported benefits from controlled breathing practices.
Easier nasal breathing itself and potentially reduced allergy symptoms as airways become more functional. Fourth, helping maintain straight teeth, especially important for preventing relapse after you've had braces or other orthodontic work.
Okay, those are big. What else? Fifth is the aesthetic side, a more conventionally attractive, symmetrical face, which, let's be honest, often leads to increased confidence. And sixth, potentially better brain function, less mental fog, simply due to improved oxygenation day and night. Better energy, mood, breathing, teeth, looks, and brain function. That's quite a list of benefits for things that are essentially free and low risk.
Exactly. It's a powerful set of tools for optimizing your physiology from the ground up with tangible structural effects. And like we said, generally very safe unless someone has severe pre-existing TMJ problems. They should proceed with caution, especially regarding intense chewing.
So we started this deep dive challenging that old idea that your face is just genetic fate. And we've seen compelling evidence that consistent, seemingly small habits where your tongue rests, how thoroughly you chew, how you breathe, how you hold your head, these things subtly sculpt the bones of your face over time. It really drives home the power of physiology and habit. And it leaves you wondering if the gentle, constant pressure of your own tongue can literally reshape your skeleton, what other unconscious habits might be quietly dictating other fundamental aspects of our physical health, our cognitive functions? Something to think about.